Hello, this is John Clark, chiropractor here at Dr. Spine Clinic in Bangalore. And we have a patient here, Kruti. We're going to assess her spine. She has a condition called the upper cross syndrome, so I'm going to explain that, and we'll do an exam, and then we'll do some treatments to show how we correct this problem for her, okay? So Kruti, we'll have you standing facing. All right, so just checking her spine to see how it's functioning. There are 164 joints in the spine, so I'm just doing a scan of all of them here. And she has some weakness in her lower back. I don't know if you can see that on the camera, but see how she sways when I press on those vertebrae. The sacroiliac joint, so that tells me there's a problem there, which we'll correct in a moment. Most problems in the spine are functional, so we're going to improve the motion in the vertebrae, and we're going to look at the muscles as well. So the combination of working on the joints and the muscles solves most problems. So she has some rib problems here as well. Ribs aren't working properly. So the upper cross syndrome is a combination of tight pectoralis muscles in front, tight extensors, weak scalene muscles, weak middle back muscles. So we're going to do some stretching and some home exercises for her as well. Okay. So Dr. Kruti, let's have you lying on your back for a moment. Okay, so the pec muscles are tight, so we're going to work on that. So I'm just going to stretch out these muscles here for you. You okay with that? Mm-hmm. So a lot of people working at computers, basically any job involves having your arms in front, so these muscles get tight. So you'll often see people with rounded shoulders. It's very, very common. So the pec muscles get tight. So by lengthening those muscles with work in the office and home stretches solves that problem. So just gently stretching out and lengthening those muscles. Now the purpose of spinal adjustments is to restore motion to the joints. I'm just going to demonstrate a neck adjustment. So a neck adjustment is just a fine motion. 99% of the adjustment is the setup, and the adjustment is just a little flick at the end. The idea there is to restore the motion and position of the joint. So if you watch your nose, you'll see there's very little motion to the adjustment. Very specific. Sometimes you hear a clicking sound. That's simply nitrogen gas coming out of the joint space. Now I'm going to do a rib adjustment. Take a breath in for me and out. So you have 72 rib joints, because each rib attaches in 3 places to the vertebrae. So we don't have to adjust all 72, but based on my test that I did earlier, these are the ribs that aren't moving properly. Breath in for me and out. So it's just a small motion to restore the function. Just take a standing for a second. So now we're going to reassess to see how we did. So earlier, the rib joints, when I tested them, she was unstable because the joint wasn't working properly. So now when I reassess, see how she's stable now. So that tells you the adjustment was successful. The ribs are now moving properly. I'm going to do one more adjustment here for the sacroiliac joint. See how it's weak when I do that. The right side is good, the left side is weak. So let's get the left side working properly. So lie on this side for me, please. I'm tangled up. There we go. Just go like that for me, please. Thank you. Okay, so the pelvis was twisted this way. I'm going to do an adjustment to move the pelvis that way. Take a breath in for me and out. There we go. I'm also going to adjust the L4, L5. Take a breath in and out. Okay, let's have you standing over there again and we'll test. Okay, that way. So of course this side is still strong, and now when I test, see how it's more stable? And I don't know if you can tell from the camera, but I'm actually pressing much harder. So now she's functioning properly. So that's how we assess the spine generally, and specifically how we treat the upper cross syndrome. Thank you.